I'm Dr. Andrew Brandeis. Welcome to part 2 of the intestinal repair protocol, intestinal diseases. So there's two main kinds of infections that you could get in the gut. There's acute infections and then there's chronic infections. So acute infections in the gut, they happen very often. They tend to manifest as acute diarrhea, which is usually self-limiting, which means that the body sort of has its own resources to overcome the problem. Diarrhea is actually a defense mechanism of the body to rid itself quickly of something that shouldn't be there. And in most cases, if diarrhea isn't self-limited, doesn't go away on its own, simple antimicrobial treatment usually does the trick and gets people back on their feet. You really only hear of acute diarrhea being an issue in third world countries where infection rates can run high and treatment might not be readily available. And in extreme cases where diarrhea can lead to death, it's usually due to the accompanying fluid loss that goes with diarrhea. But that's really not what we're addressing here with the intestinal repair protocol. What's most important here is when you have chronic infections. And these can be much more insidious, meaning they're sort of difficult to put a finger on. It could take a long time for them to appear. It could be difficult to sort of trace it back to their roots. You might even have relapsing remitting diarrhea in a case like this where you might have diarrhea for a few days and then you have a few weeks where you're good and then it comes back, and it could be very confusing what's going on. And it can even be difficult to test for what's going on because you can have what's called subclinical infections, meaning you've got an infection, it's definitely there, but it's not strong enough to show up on regular testing. So, or the symptoms are kind of there, but they're not even bad enough to show up, have a clinical presentation where a doctor could take notice of it. And the other thing to consider is you can have multiple infections going on at one time. We already discussed that the intestines are an ecosystem where millions of different things are living, and some of those things might be bad. So you can have multiple things living inside of the intestines that aren't supposed to be there. And if you have multiple subclinical infections, well, that's enough to cause a pretty big problem that might be really hard to put a finger on. So the way we do testing, stool testing, is you send a stool sample to the clinic. But there's a common misconception amongst healthcare professionals that stool testing is conclusive and that a negative result means no infection. So you may even have had a stool test that came back and it says, oh, there's no infection, and then you believe that to be true. That's unfortunate because like I had mentioned previously, there could be subclinical infections that go undiagnosed, which might even lead to invasive tests, such as a biopsy. So if your symptoms are consistent with infection, I think it's really important to continue investigating for an infection using more sophisticated methods, using the appropriate methods. One of the things that I do is I work with a lab that is run by a parasitologist who does really good stool testing, and I really trust his results. And I've seen patients have multiple infections when tested appropriately, where previously conventional stool tests showed no infection. And so these patients thought oh, well, I don't have an infection. I guess I have IBS. And it turns out, no, you just had multiple subclinical infections that were difficult to test for, and the real diagnosis is actually infection, not irritable bowel syndrome. In terms of the main sort of inflammatory disease of the intestines, we've got inflammatory bowel disease, which could be Crohn's disease or colitis. And these usually refer to inflammation or ulceration of the mucosa in the small or large intestines. So really that lining where the cells of the intestines meet the outside world where the food is coming through. If you have inflammation or ulceration there, it can lead to, acute or chronic diarrhea that may or may not have blood or mucus in it. It could lead to constipation. You could have pain and fatigue and a host of symptoms associated with that. And these symptoms do tend to develop over time, and they may wax or wane. The diagnosis of an inflammatory bowel disease is one that will come from a physician. So this isn't something you're going to be diagnosing yourself. So if you have this diagnosis, it should have come from a physician, and this is definitely a diagnosis that we can work with. Irritable bowel syndrome is a really common diagnosis these days. And this is what's known as a diagnosis of exclusion, meaning that once all other causes of intestinal illness have been ruled out, the diagnosis of IBS is then usually applied. This sometimes means that doctors can stop looking for a cause and the patient might be left to manage symptoms alone. The doctor says, well, you've got IBS and here's a couple of treatments we can try for it, but there's no sense in really examining and looking for a cause because we don't know what causes IBS. So I think that there's a lot of work that can be done with people who have IBS. And the intestinal repair protocol is tailored to help people like this. I think reaching a diagnosis in general is a very important step in medicine because it gives us sort of a common understanding of a disease process. So what we'll work on here is coming to an understanding of what the actual problem is that we're treating and then treat it appropriately. This was part 2 of the intestinal repair protocol, intestinal diseases. And in part 3, we start looking at the treatment approach for the intestinal repair protocol.